Well, hi, Joe
Hello.
Masad. You're Barbara?
I am. It's nice to
Okay.
meet you.
Now, I understand you're having some difficulty, and so I'd like to do a thorough exam. You and who are you referred by again?
Dr. Brandon.
Dr. Oh, great guy. So, tell me a little bit about your problem.
Well, they just don't fit right.
They don't fit right.
Yeah.
Okay, that's
It
good
makes
enough
me
for me.
feel
You,
really
you can stop
insecure.
there. Okay, and let me have Sarah come in. I'm gonna have her take some photos. Okay, do a couple measurements, and I'm gonna come in. I'll do it, and I want to evaluate everything in the mouth. Then I'll sit down and talk with you for a few minutes. We'll take a radiograph. In your case, more than likely, since you haven't had one in a long time, I'll probably take a CBCT just to make sure
Okay.
everything is fine and look at the bone structure. And then I'll want to evaluate what you already have in your mouth, okay, which gives me some ideas of, is it the prosthesis? Is it your mouth? Is it, whatever. Okay?
Okay.
Okay, be back.
Okay.
Hi, Barbara. My name's Sarah. I'm going to get ready. I'm going to put some dots on your nose and ask you some questions,
Okay.
okay? Let me get ready. And your chin. All right, Barbara, we're going to go through a series of questions that's going to help the doctor come up with a diagnosis and prognosis for your case, okay? You can follow along on the screen behind me if you want. Okay, now who referred you to the office?
It was Dr. Brandon's office.
And is this your age? Can you verify? I got it from your chart.
Yes.
Okay, thank you. And what would you say your attitude is? Good, average, poor, or you're just not sure?
Sometimes I get discouraged because I feel like I will never get the right fit. So I would say not very good. A 4.
Your expectations. What are your expectations out of coming to here to Dr. Massad's office?
Well, considering his reputation, I would have to say perfection.
All right, that's a good answer. And what is your main or chief complaint about your dentures?
The one I'm wearing now,
Yes.
it would be they don't fit.
They don't fit? Doesn't fit. Are you a smoker?
No,
No. How many medications do you take daily?
probably about 7,
And how many glasses of water?
about 8.
How long ago was this existing upper denture placed?
About 7 years ago.
About 7 years. How long have you been wearing upper dentures?
50 years.
And when was the last time you had an upper denture made?
A year ago.
And that's not the one you're wearing now.
No,
How many sets of dentures have you had made since you've been wearing them?
about 10.
And have you always had sets made that's always been the top with the bottom, or was there ever a time you only wore an upper?
Always the set.
Now, if you give me your permission, I'm going to take a series of photographs the way you look now so he can see how he can improve upon the aesthetics. Okay. The first photo I'm going to take, I'm going to have you have your teeth together and your cheeks and lips relaxed. But just put your teeth together and your lips will be together, just nice and relaxed, okay? And the next photo I'm going to take, have you ever fallen asleep sitting up? Your lips kind of fall apart and you're just as relaxed as you'll ever get. That's the next photo, okay? It's kind of tricky. I just want you to take a deep breath in and the next photo, I want you to give me the biggest smile you can. I want to see if I can, how much teeth I see, or if I can see teeth when you smile as big as you can. Just really, really big. And smile real big. I'm going to take a picture of the left side of your face. I want your teeth together, lips together, and everything nice and relaxed, okay? And now I want you to say 77. I want you to really say some words that make your lips move. Say, my sister Sarah.
My sister Sarah.
Now we're going to take some pictures of the inside of your mouth, okay?
Okay. And Barbara, you got the dots, and this is so that we can take a measurement of a rest position and then what the existing teeth, where they come to. The best way we found to do this is what we call the exhaustive technique, where I can exhaust your muscles by you closing your eyes, breathing in, and watch what happens. See how my lips, the air comes through? If I do that a dozen times up here, I'll be dizzy and I'll fall down. But you're sitting in a chair, so you won't be dizzy. But what I want to do is I want to get your chin at rest from the rest of the face. Okay, so I can measure and see the distance on what your existing teeth are to see how close they are. So I want you to close your eyes.
Okay.
And I want you to rest it here so you don't have any stress. So our eyes are closed, and you're going to breathe in and just listen to me and follow me, but don't open your eyes. And I want you to kind of think about falling asleep, sitting up, which we have all done. And a lot of times our mouth is hanging open. So ready, breathe in and blow. Good, good. Okay, I know it sounds like we're playing a game. So, but I want you to get relaxed. I'm not even here, and you're falling asleep. Breathe in and blow out. Okay, great. And again, blow out. You go. Good. Okay, so I have a rest position. Okay, and now I'm going to ask you to close your teeth. Okay, and when you close your teeth, I want to see how much distance now from this rest position to your teeth. So we have, it really doesn't look like it, but we have about a 10 millimeter difference. Okay, and the average is maximum generally 2 to 4 millimeters. I mean, you could go a little, maybe 5, but 2 to 4. So because being overclosed, I think I can drop your chin down, make you look a little more useful. Okay, and then, but we will more than likely have to build what we call an orthopedic splint on the bottom so you can adjust to the new vertical spacing. Okay.
Okay.
What I want you to do now, I want to see how much resistance you can give me. So when I kind of grab you here, I want you to pucker and see if you can push my thumbs out. And then smile. Pucker and smile. Pucker and smile. Okay, so you have a resistance of about 3. Okay, 5 being the strongest, 1 being the weakest, which is not bad. I'm going to parouse your mouth, and we'll take the teeth out now. And we're going to look at all of the tissues for any pathology. Open now. And I just want you to take a look. These are just the photos of prior to beginning. So this is your existing, we call facial analysis, just as you are. I think once we improve the vertical, that's going to diminish. Okay. You also take a look, and we can double click, and we actually want to see, and you have just a slight show of teeth, which I think is good at rest and smiling. You have just a little gingival show, which is very natural. So I don't think that's a major problem here. But as we go through, we're just looking for anything that may have a little bit of asymmetry to it. Midlines are never exactly right. So when you take a look at your midline, where do you reference it? Well, I don't know. Is it your nose? Is it your chin? Is your upper lip, lower lip? Is it the bottom teeth? So you look like you're a little bit to one side, but that's in the eye of the beholder. So it's, I almost let the patient says, where would you like it? If the patient tells me they want it over here, I'll put it there. It may not look good, but you know, it's in the eye of the beholder. And you have some asymmetry, nothing major. Now, when I look at the lipstick line, I think you're nice, very good. It's thinning a little bit. Mm-hmm. So if I bring the teeth out too much, the teeth may look better, but it could thin the lip a little bit. I'll try not to do that, okay? Now, when I took your spacing, remember I told you you had quite a bit of space between, and that could be easily corrected, but I want to condition you first with an orthopedic splint, and that way I can get the vertical height closer, let your body adjust to that, and let the muscle tone improve.
Okay.
Okay, then I make the prosthesis. It just makes for a much better prosthesis. Your resistance test was not bad. You're right in the middle, okay, around a 3. Some patients have 1, means they have no muscle tone, okay. So all the areas we've looked, your throat form looks like it is a class 2, which is good. If it was a 3, which means your soft palate came so far forward, we may have more retention problems. Now, interesting, when we did our measurements of the upper and lower ridge, it really shows that you have virtually no ridge on the bottom. Mm-hmm. You knew that.
Right.
And on the top, you really have a very, very short amount of space, okay? Mm-hmm. So the spacing both on your upper and your lower only is about like 4 millimeters at the max, okay? We classify this as being more guarded prognosis when people don't have a lot of bone structure, okay? And hopefully the methods we use will help you. So as I go through this, I'm just showing you, these are just areas that we needed to analyze to make a determination whether or not we could give you a satisfactory result before we actually begin. I took lip readings, I took readings of the movement of your tongue when you put the mirror in, which kind of hurt a little bit, but when you stuck your tongue out, came up, that means the floor of your mouth really, when you move, comes all the way to the forward. If we had the ability of doing implants on you, I would suggest it. In your case, with this diminished bone on the lower, I think it'd be risky. So let's make you a good prosthetic. Let's put a resilient liner in it. But you need to understand that no two mouths are alike, and that as much as I would like to say I'm going to guarantee you a perfect smile and perfect, I can't. It's just part of life. But we're going to use our experience to do the best we can for you, and I want you to understand that. Adhesive, you only need to wear that if you're going out and you feel like I need some extra. It's nothing wrong in it as long as you use a very, very small amount. But you don't have a great ridge, so we're going to do our best to give you the best retention. I'll discuss all the fees with you. And replacement therapy means, how long will these last? 4, 5, 6 years. Generally we have to, because things change. Mm-hmm. Teeth will probably still be decent, you see. But be planning on that for a period of time. On hygiene, this is so important. So if you have, just because you don't have teeth doesn't mean you should only clean your denture. You got to clean your mouth.
Right.
Okay. So on this little app here, we're going to show you. This is a Genius brush, which is basically a smart brush. It's like we have smartphones, right? And if you just go to the area, and where it says edentulous, and you can just tap on this, and when it taps on this, it's going to actually give you instructions on how we recommend cleaning.
To maintain good health, it is recommended that edentulous patients massage their gum tissue.
you doing
I
today?
am okay.
You're okay?
I'm a little nervous about the whole procedure.
And you're going to be fine. Dr. Masad is really, really gentle.
Thanks.
Okay?
Hey, Karen.
Hi.
Nervous a little bit. I know you don't get impressions very easily. It bothers you a little bit. So right now we have a new chair I think will help you. This right here has, if you're a little cold, we can turn on some heat, but I think the vibrator might be able to give you some, can you feel that?
Yeah.
And once you control that and you can make it faster, and there's different speeds there.
Okay.
If you're a little cold, I know sometimes you get nervous, you can put the heat on too.
Okay.
Okay, and I want you just to relax now. Relax your lips. Begin to. Lip out and just relax. Close your eyes now, just relax. Okay, Karen, much better. Did the vibration and the heat help you a little bit?
Yeah, it really did.
Yeah,
Distraction.
good. Okay.
Instructions for use for the Novus Compression Flask Reline. Start by evaluating the working denture to determine if there is a need to thicken it in any area to accommodate the needed thickness for the Novus. Add wax or other material to thicken the impressed denture at the lingual, buccal, or any other place that is too thin. Next, invest the denture in a compression flask. During the investment process, use a PVS material around the entire denture and over the teeth to facilitate easy removal from the flask. If processing a new denture, PVS putty is not necessary. Then boil out the denture flask in clean water. Take the denture out of the water . If putty was used, the denture should be removable from the investment. Paint both halves of the flask, including the cast, with tinfoil substitute. Let the flask cool and dry. Next, prepare the host denture by removing most, if not all, of the denture acrylic, like a rebase. This step is not necessary when processing a new denture. Now prepare a spacer on the cast. Adjust the spacer and what is remaining of the denture until both halves of the flask close with no interference. Next, mix the acrylic according to the manufacturer's specifications. Trial pack and pack traditional heat cure denture acrylic. Cure the acrylic at 165 degrees Fahrenheit, 74 degrees Celsius, for at least 1 hour following the manufacturer's mixing specifications. Once cured, take the flask out of the water and cool. Carefully separate the bench-cooled flask halves. Next, make any repairs needed to the cast and/or investment, then reapply a separating agent like liquid foil. Let dry. Remove the spacer once the flask is dry. Now, prepare the Novus by bringing it to room temperature. Apply Novus Bond liberally to the host denture. Then apply Novus material. Next, place 2 separating polyethylene sheets between the Novus and the cast, and then run the first trial pack. 2000 psi for 5 minutes. Open the flask and thumb trim the Novus. Inspect Novus for underpacked areas and add more Novus where needed. Place 1 polyethylene sheet between the Novus and the cast, and then run the second trial pack, 2500 psi for 3 minutes. When the pack is complete, once again open the flask and thumb trim the Novus. Do a final inspection of underpacked areas and again add more Novus. You will not use a polyethylene sheet for the last pack. Close the flask a final time and place it in the presser, and apply 3000 to 3500 psi. Next, clamp the flask shut and place it in a curing tank preset at 165 degrees Fahrenheit, 74 degrees Celsius. For a long-term cure, the cure time is a minimum of 9 hours. To complete the curing, an additional 30 minutes at 212 degrees Fahrenheit, 100 degrees Celsius is necessary. For a short-term cure, the cure time is a minimum of 1.5 hours. To complete the curing, an additional 1.5 hours at 212 degrees Fahrenheit, 100 degrees Celsius is necessary. When curing is complete, open the flask. Remove the denture with Novus Bond applied, and finally clean and polish the denture for delivery.
Tell me what's going on.
Well, I probably want to hear everything that's going on. The hardness right there, where it could have been a little bit fuller and smooth, and it would have helped more instead of this. That bothered me. This hard right there, up under there, it bothered me.
Okay, now if you want,
If it wasn't hard like that and like that, it wouldn't have been bothering me like that. Standing up there like that under my nose.
So,
We are go for launch. 3, 2, 1.
There, but something to help.